I want to invite His Excellency, Mr. Chin Young, Minister of Interior and Safety of the Republic of Korea, to take the floor. Excellency, the floor is yours.
Good morning, good afternoon, and good evening to you all. As the host of the 2020 UN Public Service Forum, supposed to take place on June 23rd to 26th in Busan, it is very meaningful to hold the online panel discussion today. First, I'd like to offer my deepest condolences to the victims of COVID-19 all over. My utmost respect and appreciation to the healthcare professionals around the world who are striving to protect the health and safety of humanity. The Republic of Korea was one of the first countries to experience the threat of the novel coronavirus. At the height of the pandemic, Korea had more than 1,000 new confirmed cases per day and was not able to enjoy physical exchanges with our countries as we used to. At the peak of such crisis, Korea upheld the three principles of openness, transparency, and democracy, and has responded to COVID-19 with 3T strategies of test, trace, and treat, without restricting the movement of people or banning overseas entrance. We have transparently disclosed such epidemiological data to the public, which include the number of confirmed cases and their routes. The Koreans also wear masks as a daily routine and actively participated in social distancing. In addition, massive testing enabled us to find confirmed patients at an early stage and trace their movements. Confirmed patients were then quarantined for proper treatment. With the principles and strategies, it was the dedication of healthcare professionals and high degree of civil awareness and participation that played a pivotal role in pandemic response. Also, public services offered by the central and local government, as well as close civil and public cooperation, laid an important groundwork. From the outset, the Central Disaster and Safety Countermeasure Headquarters has been in place to bolster government-wide, consistent, and swift response. The CDSC headquarters has held daily meetings attended by the Prime Minister, relevant ministers, and heads of local government. The meetings have served as a government-wide regular communication channel to quickly address difficulties on the field and spread best practices. Local governments in particular are the key players. Many creative ideas came from them, including drive-through screening station for quick and safe testing. And dedicated local officials are in charge of management and support for those in self-quarantine, which once amounted to 59,900. ICT-driven public service, such as epidemiologic studies supported by big data analysis, safety protection app for the self-quarantine enabled efficient prevention and control of the infectious disease. Yet, COVID-19 is far from over in Korea. We still experience sporadic cluster infections. And if a vaccine or a treatment is not developed in time, a new wave of infection would be something to be expected. The world is in the same situation. International solidarity and cooperation are in order to share quarantine experience, provide resources to vulnerable countries, and develop vaccines and cure. Korea has shared the knowledge and experience accumulated in our response to the COVID-19 pandemic with the international community and plans to provide humanitarian assistance worth $100 million this year. I believe we need more active international discourse and collaboration, not only to overcome the current crisis, but also to explore the new role of public service in the post-COVID-19 era. As the government's role and authority are expected to grow, now is the time to make efforts to realize more efficient and productive public service, as well as promote transparency and democracy. In this regard, today's online forum, under the theme of Pandemic and Public Service Delivery, examining the critical role of public servants at local and national level, carries a great significance. Without the dedication of healthcare professionals, civic awareness, and quality public service all around the world, we would have had a much harder time combating COVID-19. Today, we are joined by distinguished panelists with various expertise, namely the central and local authorities and the healthcare professionals who are leading the responses against the pandemic. I hope today's discussion will serve as an opportunity to examine the role of public service in response to the pandemic and seek future direction of public service in the post-COVID-19 era from diverse perspectives. I sincerely hope that all of us will pull our wisdom and strength together to overcome this crisis and return to normal lives. Thank you very much.